Profunda. What do you mean by this word profunda?
Deep.
Correct. So from here you can see, you can make it out that this is going deep. Profunda brachial artery is the deep artery of the arm. Okay, profunda brachii. So deep and arm. So it is the deep artery of arm. It is the largest branch of brachial artery. That is why I am stressing on it so much. This is the largest branch of brachial artery. And if you want to make some more better observation, it has the most superior origin. Okay, it has the most superior origin. It is the largest branch of brachial artery, and it is the deep artery of the arm. So it is passing posteriorly around the shaft of the humerus. So it doesn't come up anteriorly like this. It comes up posteriorly along the shaft of the humerus. And after that, this profunda brachial artery, this is going to give rise to something called as, it is going to give some, normal branches, like from that side, one branch is going to come up like this. Okay, now this is on the radial side. So this is called as radial collateral branch. Okay, this is going to be the towards the radius side is the radial collateral branch, and the other one, the other continuation, see from here, from this position, one is coming up in the front towards the radial side, so that is the radial collateral branch, and the other one which is actually continuing down, very good, that's the middle collateral branch. So profunda brachial artery, it further branches into middle collateral branch and radial collateral branch. It's so simple. Then, and over here later on we will see that so many branches are forming, so many collaterals are forming. This is later on going to form some anastomosis over here. And anastomosis, I guess everybody knows that it is just those network. Okay, network of plexus of blood vessel. So we will see such junctions taking place over here, forming anastomosis around the elbow. Now, just before proceeding ahead, I'll tell you one more thing. That is, from here, there is one more branch coming out along, in the middle region approximately. This is called as nutrient artery, humeral nutrient artery, and it enters the nutrial canal. So this humeral nutrient artery, suppose I start to draw it from here. Okay, it enters into the anteromedial nutrient canal. So humeral nutrient artery, it arises from the brachial artery around the middle of the arm and enters the nutrial canal on the anteromedial surface of the humerus, and artery runs distally in the canal towards the elbow. And everybody has heard that saying that towards the elbow we go, and towards
From the knee I flee.
yes, from the knee I flee. So it is moving towards the elbow. So this is about the humeral nutrient artery. Now coming to those small ones that we have discussed, that is the superior ulnar collateral and the inferior ulnar collateral. So it's not so important over here because I have told you that they are going to form anastomosis over here. So it will anastomose, and this one will also anastomose, this one will also anastomose. So almost our job over here is done. So I guess everybody is clear related to this portion.
Yes, sir.
Right. Now the next thing that we are going to talk about, that is the radial artery. So radial artery and the ulnar artery. These are the two things which are left over here. So how is this radial artery and the ulnar artery present? Let's see. First of all, when you will talk about the radial artery, that is the one which is passing over the radius. Now it is going over here. If you remember, there was present some interosseous membrane. In this region, there was present some interosseous membrane. Now, this radial artery, this will be having some recurrent interosseous artery. Okay, it will be having some recurrent interosseous artery. Now, another thing, whenever we use this word recurrent means you are coming backward. Recurrent, the current is coming back. So suppose there is a pipeline which is moving in this direction, And if this pipeline suddenly turns back, so you're moving in this direction and suddenly it turns back, so you call it as a recurrent branch. Okay, recurrent, wherever you will see, you will always have a tendency to observe this, that it was moving forward and then it turned back. It's like this. Like suppose I tell you that this is the radial artery, so radial artery is going down. Now imagine one branch from here, it suddenly moves backward. Suppose one branch over here suddenly moves backward, and so you should call it as what? You should call it as radial recurrent artery. Yes. So this is radial recurrent artery. Then it is going to anastomose with this one. What was this? This was the correct. This was the radial collateral artery, and this is the radial recurrent artery, and they are going to go and they are going to anastomose over there. In the same way, this radial artery is going to move downward. Over here, it is going to move downward like this, and over here there is going to be the carpals present. I'll just make some arbitrary diagrams over here. Okay. Okay, so metacarpals, and 1, 2, 3, 1, 2, 3, 1, 2, 3, and 1, 2, and 3. So I have made the metacarpals and the phalanges. So what will happen? This is going to move down over here, and after that this is going to form a carpal arch, a palmar carpal arch over here. So after this it is going to form the deep palmar arch. So over here you will see that there is a palmar carpal arch, and after that you will see that there is present a deep palmar arch over here. Deep palmar arch over here. And from here you will see that these vessels are moving towards the digits like this. So this is about our the radial artery. So what do we see over here? That radial artery, it originates as the terminal branch of brachial artery in the cubital fossa. And what do we see? It runs inferolaterally, and it you can say lies lateral to the flexor carpi radialis. It is present lateral to the flexor carpi radialis. Over here, if you remember, there was a flexor carpi radialis present. It's lateral to the flexor carpi radialis tendon in the forearm region, and then winds around the lateral aspect of radius and along the floor of the anatomical snuff box. So remember that you must be reading that it is forming the floor of. From ulnar artery also, imagine one branch is going to the way, suppose this moved up, in the same way from this ulnar artery also, suppose some branch moves backward. So what do we call this? If it is moving backward, so what do we call this?
Ulnar recurrent.
Correct. It is the ulnar recurrent artery. Now over here there will be two such things. One is the anterior ulnar recurrent artery. One will be the posterior ulnar. Yes. And they are going to anastomose with both this superior ulnar collateral and inferior ulnar collateral. So collateral will anastomose with recurrent. So you can imagine this picture. One is collateral and one is recurrent. So they are going to form anastomosis. And after that, this ulnar artery is going to move down to form again palmar carpal branch of ulnar artery. Yes. So this is going to move down to form the palmar carpal branch of ulnar artery, then the superficial palmar arch, and then this anastomosing network is going to form over here. So over here, what are the important things that we have learned? We have learned, first of all, there was a subclavian artery, and from the subclavian artery, when the subclavian artery turns around and it reaches say the lateral border of the first rib, over there, from there onwards, we started calling it as the axillary artery.
Axillary artery.
Axillary.
Yes, why? Because this region is the axilla.
Axilla.
And till how much we will call it as axillary artery? Till the
Inferior border of the teres major.
very good, inferior border of teres major, and henceforth till cubital fossa we will call it as
Brachial artery.
brachial artery. And then beyond that region there will be two arteries present, radial artery and the ulnar artery. So we have learned that when we talk about axillary artery, we will take pectoralis minor because it runs posterior to the pectoralis minor. So we will consider pectoralis minor as our reference frame. Anything above it, we will call that as first part. Anything behind it, that's the second part. And beyond it or after it, inferior to it, that is the third part.
Third part.
Correct. First part has got one branch, second part has got two branch, third part has got three branch. So
Three branch.
nothing can be easier than that. So when we talk about this first part, so in the first part there was superior thoracic artery present. Second part, I said there was thoraco.
Lateral thoracic artery and thoracoacromial artery.
Very good. So there is lateral thoracic and there is thoracoacromial artery. Now comes out the third part. So third part, I said you should think about the relation with scapula.
Subscapular.
So subscapular artery, and then we
And
have
anterior and posterior circumflex humeral artery.
very good. So there is going to be an anterior and the posterior circumflex humeral artery. So these are the easy parts of axillary artery. So after this, when we talk about the brachial artery, that brachial artery, you will see immediately on the medial anteromedial portion, it will enter into in the middle of the arm, in the anteromedial portion, it was entering into the nutrient canal. So that was the nutrient humeral artery. But what is the highest branch? What is the one which has got the highest branch? Very good. It is a profunda brachii artery, and from the word profunda and brachii, from these two things you can easily understand that first of all,
Artery of arm.
correct, deep artery of arm. So it runs along the posterior portion of the arm region, okay, posterior side, and it gives two branches. One becomes the
Radial and middle collateral artery.
correct, radial collateral and middle collateral artery. And then we could also know that there are some other branches present. What was that other branch? It was the superior, so radial collateral you have learned.
Superior ulnar.
So what is neglected? Ulnar. So ulnar, again we had two names. This time it was radial. One
Superior
was
and inferior collateral artery.
very good. So on radial side we have seen that there are two such collateral. One was anterior, other one was middle. In the same way, for the ulna we have got not anterior middle, we have got superior inferior. So superior collateral and inferior collateral. Can you visualize the picture? Don't try to mug up so many names. Don't try to remember so many names. Try to visualize the picture and try to correlate your terminology with that picture. Always try to picture this photograph. This picture should be present in your mind. That is what I said. That this is what anatomy is all about. So you should have a complete clear idea related to the structure. So this idea is clear. After that, you will see at cubital fossa, that is this portion I said, over here it will branch. Once it branches, it gives the radius side is going to be the radial artery, ulnar side is going to be the ulnar artery. And we have already learned over here that so many collaterals are coming. What will happen to all these collateral? They are going to anastomose. With whom?
Anastomose with recurrent.
Recurrent, very good. So it is going to anastomose with recurrent. So if we have got the superior and the inferior ulnar collateral, then it is going to anastomose with the ulnar
Ulnar
recurrent.
recurrent artery.
Correct. And if we have got on the other side anterior and the middle, collateral artery, anterior and the middle radial collateral artery, then they must be anastomosing with the
Radial recurrent
correct,
arteries.
radial recurrent arteries. Otherwise, what will happen? The radial artery is going to move down. Okay, it will go near the wrist region, and over there it is going to form the arch. Okay, anastomosing arch over there.
Dorsal carpal arch
Correct, dorsal carpal arch it is going to form, and the palmar carpal arch.
and deep palmar arch.
Correct, that is the deep palmar arch.
Palmar arch.
And after that it is going to, and where it is and with whom it is anastomosing? Of course with the ulnar side. So what is happening? If I talk about the ulnar artery, so ulnar artery is coming up, and then again it is going to form the same branches. And also, just if you can remember, it's always best, that is, if you can pay some respect to the interosseous portion, because there was some interosseous membrane, and to that the interosseous branch was also being supplied. The interosseous branch was supplying the interosseous part of the radius and the ulna. So what do we see? You will see that there are like in this region present a large number of veins, and I'm using some different color for this. So suppose over here from this finger region, the digits, these are the veins which will be draining it. Now all these veins, I'm talking about the dorsal aspect, okay? On the dorsal aspect, all these veins, they will be again having a lot of networks over here, anastomosis over here. Now all of these, they are going to form a dorsal venous network. Okay, but some people have got some venous network which are visible over here. Okay, some veins, they will be visible over here. So what is that? That is basically the dorsal venous network. Yes. Now you will see that
The dorsal venous arch.
yes, it is the dorsal venous arch or dorsal venous network. Now from here, from this network, you will see that they are moving. They are move, like if I'm talking about this as the dorsal side. So from here they are all going to move on this side. So from here this side, and from here this side. So they will be coming up to the supine surface. So from this region, there one branch is going to move on that side, another branch is going to move on this side. Okay, so it is going to move like this. Now this portion which is present towards the other side, suppose this portion which is present, this is going to something called as the basilic vein. Okay, this is going to a place called as basilic vein. Now there are two veins which will come up over here. Say I'm mentioning, this is going to, like I said, this is going to basilic vein.
Cephalic vein.
Very good, cephalic vein. Now question is, how to remember this, and what is this basilic and cephalic? What are these stuff? Actually, what happened? These names, unlike your Greek and Latin, these names come from the Arabic words. Okay, so initially, when the author saw this thing, like the doctor saw this thing for the first time, he named in Arabic as al-kifal. Okay, al-kifal means it is outer. Okay, so it was the Arabic word al-kifal. Later on, he published a book where again al-kifal name was written, but there was some very dangerous translator present who actually translated it. This one they translated it as this cephalicus. Okay, cephalicus. So it is basically, you can say, sort of mistake, but certain mistakes keep going on and we keep following it. So you also can follow this mistake, and we call this as the cephalic vein. So initially it was like this, and al-basilic, in the same way, al-basilic, it means, see, if al-kifal means it is outer, that means al-basilic means it is inner. Yes. So now I guess you will be able to remember this, that this cephalic portion, this is present outer side, that is towards the radial side, and this basilic, it's towards the inner side, that is ulnar side, medial side, of course. And try to correlate it in this way, that this up because of the way limb is placed in the embryonic position. But I don't know how much is valid information, but some authors, they do say so. Anyways, so let's see what happens next. So this time I have shown you this portion from the you can say the dorsal aspect, but you understand that now it is time that we should start seeing what is happening to the palmar aspect.
Palmars.
So I think rather than continuing this up, I think I should continue it on the palmar aspect. That there are the perforating veins. See, first what we have learned the main superficial veins of the upper limb, that is the cephalic and the basilic vein. They originate in the subcutaneous tissue on the dorsum of the hand. Okay, from this portion, that was the dorsal venous network. So this is first thing that you should remember, this picture. Second thing that you should remember, that is the perforating veins which are present, they form communications between the superficial and the deep veins. Now after this, we will, if I focus on the cephalic vein, so cephalic vein ascends in the subcutaneous tissue from the lateral aspect of the dorsal venous network. Okay, from that side there was the dorsal venous network, if you remember. So it is continuing from there and it is ascending upward, and then it proceeds along the lateral border of the lateral border of the wrist and the anterolateral surface of the proximal forearm. Okay, then anterior to the elbow, the cephalic vein communicates with the what was this vein? This one, okay, it communicates with this median cubital vein. Okay, and this median cubital vein is going to pass obliquely across the anterior aspect of the elbow in the cubital fossa, and then this is
There
going
is some
to.
disturbance.
Yes, sir. The sound is.
So what I was saying, that this is the
It's joining with the.
so this cephalic vein, it joins with the median cubital vein, which passes obliquely across the anterior aspect of the elbow in the cubital fossa and joins the basilic vein over here. Okay, it joins the basilic vein. After that, you will see the cephalic vein is going to course superiorly between the deltoid and the pectoralis major muscle, that is along the deltopectoral groove, and then it enters into the clavipectoral triangle. If you remember, last we have discussed about the clavipectoral triangle, and then joins the axillary vein. So axillary vein is the ultimate point. Like we will see the basilic vein also, it ascends in the subcutaneous tissue from the medial end of the dorsal venous network along the medial side of the forearm and the inferior part of the arm, and then it passes deeply near the junction of the middle and the inferior third of the arm, piercing the, over here it will pierce the brachial fascia, and then it runs superiorly parallel to the brachial artery. Okay, parallel to the brachial artery.
Yes, sir.
And it merges with the what do you say, the local veins, that is known as the venae comitentes. Okay,
Vena committed.
venae comitentes, yes.
Yeah.
And then they are going to form the axillary vein. So this is the.
So the vena committed.
Let's define cubital fossa. So what do you mean by cubital fossa? Because we have been discussing about cubital fossa. So as a basics, one must know what is cubital fossa. So what do you mean by cubital fossa? Cubital fossa is the depression on the anterior aspect of the elbow. Okay, cubital fossa is seen as the depression on the anterior aspect of the elbow, and there will be some three boundaries. So let me draw it for you first. Once again, I'm going to make a dotted picture like this. So let's say this is the arm. Like this. And over here, if you are looking at this arm from the front side, then you will see here there will be present the biceps brachii, which is forming tendon over here, if you remember this.
Tendon.
Yes, so this is biceps brachii forming tendon over here. Then you will also see that, if you remember, of course, over here there is going to be the brachioradialis. Brachioradialis was present over here. Like this, we discussed this brachium and the radius. So suppose this is the radial side, so that's the brachioradialis portion present, and suppose this is the medial side. So over here there will be one more interesting muscle present. What was this muscle on this side? So this is medial, this is lateral. So what is this muscle present over here? This is going to be over here pronator. You remember pronator muscle?
Pronator.
Correct, pronator teres. So over here we will see that there is present this pronator teres. There are many more muscles present. Over here there will be, we will talk about pronator teres. So if you observe over here, so can you see this angulation forming, the angle?
Yes.
Yes. Now if I tell you that, okay, let's make some imagination. Suppose I draw an imaginary line over here, and suppose I tell you that this is the this is the imaginary line present between the two epicondyles. Will you understand this?
Yes, sir.
Mm-hmm.
Yes. So now if I tell you that, say, where is the thing? So suppose now I tell you that over here, do you observe this triangle? Not love triangle, I'm talking about this triangle. Okay, this triangle. This triangle is basically your beloved cubital fossa. Yes. So, what are the boundaries that are present? Superiorly, imaginary line connecting the medial and the lateral epicondyle.
Two epicondyles.
Yes. Second one, that is medially, it will be
Lateral
the
border of pronator teres.
correct. It is the pronator teres muscle present.